Olson, and I am a registered nurse and Senior Director of Quality and Risk at Dignity Health Memorial Hospital. Thank you for joining us for this special Facebook Live event, and thank you to our host, KERO TV 23. Today we are discussing a topic that most people living in Kern County are familiar with, valley fever. Valley fever is an infection caused by a fungus that lives in the soil, and we are seeing a record number of cases here in the Southern Valley. Before we get started, I'd like to introduce our panel today. We are joined today by Dr. Ziba Yaman and Dr. Paula Miller, both family medicine physicians with Dignity Health Medical Group in Bakersfield, and Paula Einstein. Paula is the daughter of Dr. Hans Einstein, who was the foremost authority on valley fever, and now Paula advocates for valley fever research and education. I will be monitoring the live feed and reading some of your questions. Let's get started, and I will kick off this by saying I was recently diagnosed with valley fever. In early July, I woke up with flu-like symptoms. I had body aches, I was overwhelmingly tired, and had a mild fever. The next day, I woke up and I had 2 different types of rashes from head to toe. I received appropriate treatment and thought I was on the road to recovery. My symptoms continued to progress until I had a rash with nodules and severe joint pain in my wrists, knees, and ankles. At that time, my primary care physician sent me for a lab test, and I began the treatment when the test results came back positive for valley fever. Today, we'll start the panel questions with, what is valley fever, and why is it so difficult to diagnose?
Okay, so like you just mentioned, valley fever is an infection that is caused by a fungus. And it primarily affects the lungs, but like you had the symptoms of rashes, and it can manifest in other ways also. Although it's endemic in this area, it's still difficult to diagnose because sometimes the symptoms are just like flu-like symptoms. So most physicians think of flu and a virus or a bacterial infection. They don't think of a fungal infection. So that is the main reason it's missed usually.
And why are there so many cases in Kern County?
I think it's sort of unknown in a way. One of the reasons is because of the dry conditions, and that's probably the main reason. So we have very little rain, lots of dry conditions, which are perfect for the mold or the fungus to grow in the soil. And then with the winds that pick up in sort of late spring, we get the mold and the fungus in the air, and people are able to inhale it. The other thing that's interesting, and one of the reasons why we may be seeing more cases, is simply the fact there's more people. This area has grown so much in the last several years, so more people means more cases, and I think the testing is better too. So the combination of those 3 things are probably what increase the numbers.
Okay. We have a question that's come in, and they're asking, can it be cured?
Someday.
I think the short answer is no. I mean, generally, the good news with valley fever is generally people who contract valley fever are sick. Do get better. They do recover without any long-term complications or problems. And in that situation, generally, at that case, although not 100% true, you can't catch valley fever again. So is there a cure per se? Again, no. But like I said, most people, after they're treated for valley fever or after results, they do fine.
Okay. We have another question that's come in, and they're asking, what is the treatment for valley fever?
So we treat valley fever with antifungal. Since it's a fungal infection, there are different type of antifungal medication that we can use. Depends on the site of infection, depends on the severity of the infection, but it's antifungal medication.
Okay. And what kind of research is being done on valley fever?
Oh, so much in so many different areas. I will say one thing. The fungus is very specific, the soil it likes to grow in, and it just isn't in most of the country. It's just in a few very specific places. It really doesn't even go any farther than Sacramento, and so some of it's just the strange anomaly of that little thing that,
Exactly.
and it just isn't very widespread. There are lots of things going on. There's a group in Arizona that's also working really hard on research. In the 90s, there was a lot more money going around, and things were just rolling right along, and that did dry up. But there's been some money allocated for research there. There's a lot of research going on in dogs, and it looks like there's going to be something available for pets, and that's a good sign because that's that much more research that won't need to be done for people because they've already gone through that stage with pets. There's several drugs. They're still working on a vaccine. The other thing that you said is that once you've gotten it, it stays with you forever. It really never goes away. People like to say, I'm immune now, but you're never immune, and it can flare up. And it can flare up if you get something like lupus, and it can come back with a vengeance, and it can flare up. It will flare up if you have any kind of transplant and things like that. So if you don't know you've had it, and you wandered through Kern County once a long time ago, and you get a kidney transplant, and you're somewhere on the other coast, it's going to not work. It's going to be rejected, and it'll be because of valley fever. So one of the things that's happening is that we're trying to get a low-cost, simple test so that everyone can find out if they've had it. Because you can have had it and gotten it over, you got over it on your own, and you don't even know, but you need to know.
Right, which is usually how good points, and usually how, the story of valley fever goes. Most people, I think, 50% of people don't even know that they've had the infection. So that goes to your point of you very well could have it, and like you said,
and
something
it's in there.
Yeah, and something happens down the line. You're immunocompromised, for your immune system is low for whatever reason. That's when you start to develop the symptoms. Yeah.
So you lead us into our next question. You mentioned the immunocompromised patient. Who's at greatest risk for developing valley fever?
Well, I think it's those patients, cancer patients, people who are on chemotherapy, people with other chronic diseases, diabetes, for example, it makes you at higher risk, and you treat those people a little more aggressively than you may treat other people, HIV. Interestingly enough, certain ethnic groups, African Americans, Filipinos, not more likely to get valley fever per se, but more likely to have complications, dissemination we call, where it spreads to other areas. So, yeah.
Okay.
And pregnant females.
Yes,
Third
big one.
trimester, pregnant females.
Yes,
Okay.
pregnant females, another
Thank
big
you.
one.
And leading to another question, what are the symptoms of valley fever?
So mostly it presents with flu-like symptoms. So cough, fatigue. Fatigue is pretty severe usually, and if it spreads to the other parts of the body, you can have joint pain, rashes, and night sweats. Those are the most common symptoms that you have.
Okay. And then how do you know if you have valley fever or something else based on those symptoms?
You have to go to a physician.
Yeah, I think the answer is you don't.
One of
Yeah, you
these
don't.
guys.
Yeah, it's testing that will show us what you have.
Yeah.
Another thing you were talking about Filipinos, and because there does seem to be a genetic component. There's also a genetic component in animals. Boxers and golden retrievers get
there
it
you
more
go.
than other
know
breeds. So there's something going on there that we don't understand at all.
Sure.
We have a question that's come in that's asking, how common is valley fever?
Well, I think the answer is it's common. Statistics, people like statistics. I think they say, 3% chance a year of developing valley fever if you live here. So that sounds low. But again, this is an area where valley fever always needs to be thought of. I always say to my patients when they come and they've had cough, and especially if it's prolonged, you're getting a couple weeks out, it's on the list. So around here, I think it's common.
Okay. And then another question that has come in, is valley fever contagious, and can it spread to others in the household?
It's not, you can't get it from another person. The only way you get it is from inhaling the spores from the air. So it's not contagious.
Okay.
Can't spread.
Right. You mentioned pregnant patients are at higher risk. So someone's question is, what precautions should they take, or pregnant women in our community?
So if there's a dust storm, stay inside. And usually the mask that you can use, the kind that cover your face, and you can inhale the spores. Use them when you're going outside. But most of the time, it's just staying inside when there's a dust storm or you can see dust.
Okay. And that answers one of the other questions that has come up. How can people protect themselves from valley fever? Is there anything else that either of you would like to add?
No, you really need to stay inside. It's really about, you're not going to get it from your garden. You know, it lives in untouched soil, about 2 inches down. So if you just built a new home and you're putting in the yard, then it could be there. Not so typical if you bought something that was farmland before, but if you're up in the hills, then it could be. So there are a few times when you think, oh, this might not be good, but most of the time it's really just sort of trying to stay out of the line of the fire. And you just can't know. You can get it just driving through. A truck driver can get it driving through on the I-5.
Mm-hmm. Yeah.
You know, there's no telling. Yeah.
Yeah,
Isn't that encouraging?
One thing I sort of learned the hard way is be an advocate for your family. For example, my daughter who plays soccer, a windy day with plenty of dust, and I said, "Oh, you're not going to soccer practice?" Say, "Oh, yeah, I am. Valley fever." That's how she contracted. I mean, that's the guess. I mean, it was a horribly dusty day. So just common sense, you know, and for your family too, not only yourself, but keep your family safe.
Okay, thank you. A question has come in: isn't there a blood test to show you how active your valley fever is?
Active? Well, when it's active, yes. That's the test right now, is a blood test.
What type of doctor can treat or diagnose valley fever? A family practice physician or only specialists?
It's so common here in Kern County that most primary cares are taking care of it. If it's a disseminated, really severe disease, infectious disease, or pulmonologists are where we send our patients. But usually primary care is able to take care of it.
Okay. And we have a question coming in that's saying that medication and treatment, is it costly?
That's a good question. I think it depends. Like any medicine, you're always surprised sometimes with medicines. You know, sometimes people seem to get medicines without problems, and sometimes not. Generally, my take on that is generally no. I haven't had a whole lot of trouble lately. Typically use fluconazole or diflucan, and it seems to be a pretty reasonably priced medicine to get.
Yeah, the funny thing I think is with insurance, because it's considered an off-label.
Yeah.
And that causes problems sometimes, and so people end up having to spend more because their insurance doesn't want to cover it. It seems like, can't we change that? You know, can't we just make it, part of it?
And we have a question that's come in that says, why does it seem like more men than women get valley fever?
I think that's I don't know if anybody knows, but that anecdotal, I mean, obviously somebody has an anecdotal experience. I think that's true. Generally, men, for whatever reason, I think it's unknown, seem to be more susceptible. I don't know if you have any.
Maybe their jobs, more outside
jobs.
jobs.
Outside more.
Maybe.
And,
Yeah, there you go.
So,
Leading into our next question, other than the ones we've already mentioned, but who else may be at highest risk for valley fever?
Well, that's something they're working on right now. I mean, there was just a study done. Royce Johnson and his colleagues did something looking at exactly that. They did find Filipino. They did find a few, other groups, and I can't remember who they are, which isn't real helpful, is it? But there does seem to be a genetic component. They don't know enough yet to be able to define it clearly. But even finding out that, my dad knew boxers got it more just because
Right.
But the golden retriever was a new one, so there's something there. We don't really know yet. I think African Americans get it more commonly. They're still looking. It's always one little piece of the puzzle. It's a big puzzle.
And a question has come in: why do some people have a mild case and others get critically ill?
Again, I don't know if anybody knows. Again, we highlighted those those groups that are more at risk, again, the diabetics, immunocompromised. But
Yeah.
generally, if you just have, I mean, Amy, even someone for yourself, like yourself, I mean, probably no rhyme or reason why you were hit, as
Might
hard
be
as
how
you
much
were.
you breathe in.
Yeah.
Might
yeah.
be how many spores.
You breathe in.
How quickly, how much your system got to it and was fighting it until you were diagnosed. There's probably so many reasons. What your immune system is doing at the moment.
Okay. And there's a question coming in. Do you have to move from Bakersfield to get better?
Oh,
Once you have it, you have it.
Yeah.
So moving will not make a huge difference.
Unless you're moving to Santa Barbara.
Oh,
yeah, if you move to Hawaii, it can't hurt.
Right.
Can't hurt.
Little ocean
I
therapy.
recommend it.
A question has come in. Can kids who have it go to school, and how long does it take for them to recover?
I mean, I think the answer is you can go to school. Typically, what you see when you know somebody has valley fever, you've made the diagnosis, fatigue can be severe, I think Dr. Yaman was saying. And I know, personal experience, my daughter, it was months until she got her full energy back, and it was weeks before she went back to school. So that's usually what puts people down is the fatigue. But you can't, like we said earlier, you can't spread it. So going to school is fine if you're up to it.
Okay. A question has come in that says, are people who struggle with lupus more likely to get valley fever? I think, Paula, you mentioned lupus earlier.
Again, it's just where you breathe. You know what I mean? I mean, it's not like the little spores are going around looking for us. It's just if you happen to inhale it. I would imagine if you were any immune compromising disease could possibly make it worse because your body's already taxed.
Yeah.
But you either breathe it in or you don't. That's so random. It's so random.
We have a question that they're asking, does it affect asthma? A viewer says she was diagnosed 10 years ago, and it seems like her asthma has worsened since her diagnosis.
Yeah, I don't think so. Of course, you can have chronic lung issues, especially if you have a case that leads to a cavity in the lung. So if you have that or scarring in the lung, so I guess in theory, if you're already an asthmatic, potentially that could make that worse. But generally, those people don't do worse than those without asthma.
Okay. Once individuals are diagnosed and on diflucan or one of the antifungals, is there anything that they can do regarding their diet or supplements to help fight the valley fever?
I guess just a good diet. When we start someone on those antifungals, we do monitor their blood levels, their liver enzymes, and everything. So maybe less alcohol. Otherwise, yeah, just a good diet.
Good diet.
Yeah, I agree.
Okay. All right. Another question has come in. Does valley fever affect them more than just your lungs?
Yes, it does. Actually, I've had a couple of patients who came in with rashes, had no cough, no flu-like symptoms, nothing, only a rash. And the rash was not going away. He had been to urgent care and ER, and nothing was taking care of it. So when we checked for the titers for valley fever, it was positive. So it can present in different ways.
Yeah, I think the other common area is joints. So you can have somebody just comes in with a swollen knee. Knee is typically the most common joint, but it can be other joints as well. And bones. I mean, people get valley fever. Another common site of dissemination or spread is to the bones, back pain. So you could have somebody come with back pain for a year. And then, Paula just mentioned the brain, which is the most devastating complication. We haven't talked about that, but meningitis, coccymeningitis is a bad disease.
Yeah, then you're in trouble.
Yeah.
And we have some new viewers joining us, so we're answering some of their questions now, but a new question has just come in. Is it from digging in the ground or is it just in the air?
Well, it lives about 2 inches under the soil. That's where it is. You're more likely to get it. That's why Shark's Tooth Hill was such a problem, because people were they were digging up untouched soil. There's also something, it likes a plant called the creosote bush, which looks a lot like a It's an ugly little thing. It's just this really funny little plant. And it lives, like usually if you find creosote bushes, you'll find valley fever spores because it likes that soil. It's so specific, the kind of soil it looks like, that it likes, and that's the good thing. It's very unusual what it likes to live in. But no, yeah, if you're out digging up in the hills in untouched ground, it could be there. Just go 1 inch down. Don't go 2.
Don't go 2 inches. Okay. I have a question here that's asking, what is disseminated valley fever?
So if it's just localized in your lungs, that's simple valley fever. If it spreads through your blood to other parts of your body, joints, your brain, it's disseminated.
Does smoking cigarettes reduce your chances of getting valley fever?
No.
No.
No doctor would ever say that. But the answer is no.
A good diet and no smoking. Another question's come in. Do you tend to see a lot of patients that work in the oil fields come in with valley fever?
Yeah, that's kind of an anecdotal thing. No, I don't think so. It makes sense, though, that you maybe would just because of their work environment, but I can't say I have.
Okay.
Actually, farm workers, I've seen more farm workers with valley fever.
Yeah.
But again, it could all be because they're outside all day.
Yeah, I mean, that's the reason.
That's possible.
That's it,
Yeah.
I'm sure.
I mean, that's what makes it hard.
Yeah, breathing in those spores, right?
Yeah, all day.
One thing to take away from today. How can we protect our pets from it, from getting valley fever? I know Paula mentioned earlier about...
No digging, bad dog. It would be the same for you. Keep them inside, I suppose, when it's real windy. My father actually did diagnose a boxer that lived in the condos because he heard him coughing. And he, after 2 weeks of the dog coughing, he finally said, "You need to go get him tested. I think he's got valley fever." And he did. And they used to leave him out on the balcony a lot. So, you don't even have to be. That dog never saw untouched soil, and he got it. So there you go.
Let's see, another question's come in. Should people who live in the valley get routine screening for valley fever?
That's interesting.
Right now, routine screening is not recommended, but like you said, we are hoping that we can find some test that's not as expensive, and then maybe we'll consider it. But right now, it's not recommended.
And they're working on that,
Yeah.
actually. Kevin McCarthy's been really helpful in trying to get a low-cost, scratch test, something simple that could be everywhere, and then you could just have it done. That should be happening pretty quickly. And then it would be great. Then you could get yourself tested,
Right.
whenever you felt uncomfortable, whenever you were worried. But then you'd still have to see a doctor. That wouldn't,
Right.
it's like, oh, okay.
That would hopefully be in our future, not in our
Yes.
current situation. Still some viewers joining in now, asking again about what the symptoms are for valley fever.
Tell about the more unusual ones, maybe. I had a very unusual one. It hurt here on my collarbone, right here. I thought I'd fallen off my horse and hurt it. And it turns out it was because the spore, you don't have any feelings in your lungs. It manifested right here on my collarbone. And, so you can have, I didn't have any of the other stuff. I didn't have a rash. I wasn't tired. I wasn't even tired. I just had this pain that wouldn't go away right here on my collarbone.
Yeah.
So, I think you mentioned a couple other unusual ones. Yeah.
Yeah, usually it's cough, night sweats, fatigue, and then you can have joint pain and rashes, and if it spreads to your brain, headaches, and all the meningeal signs.
And why is awareness of valley fever so important?
Well, I just think because even though it's common and here we still obviously have a lot of cases that don't get diagnosed. So, knowledge is power when you go to your doctor. And if you think, hey, I've been sick for a while, and I don't know what's going on, but no one's really said. I think, Amy, that was, again, your kind of story, being able to say, hey, what do you say to your doctor? What do you think about valley fever?
Or your Aunt Ethel comes to visit from Ohio and goes back to Ohio.
Yeah.
and she starts coughing. I worked on a movie that shot in Taft, and at the cast party I said, if any of you have a cough that lasts 2 weeks, you call me. And 4 people on the crew ended up with valley fever.
Wow.
You know, so if Ethel's coughing, she goes, I just can't seem to shake it. That's when you'd have to do it. You'd have to be her advocate, because they're not going to know what it is in Ohio, and you know.
Right.
Yeah, that's one of the main things about knowing what's going on. It's for others, you know.
And that leads us to another question that has come in. Is valley fever only in Kern County? We talked a little bit about it earlier, but where else can people get valley fever?
So it's in Kern County. It's in some other parts of California also. It's in Arizona, New Mexico, Utah, some parts of Texas. So it's but it's mainly concentrated in Arizona and San Joaquin Valley here, Tulare County, Fresno.
A little in Mexico.
Oh, Mexico
Yeah.
also, yes.
Yeah.
A question has come in. Should we be concerned with all the new home construction going on? We talked about the dust earlier and the digging of the new home sites.
It's possible. They do a lot of watering, and
Yeah.
some of that's to keep that down. You know, there's a lot of watering when construction's going on, so that there isn't a lot of dust that's stirred up.
We have a question that's come in. What about tests showing negative, but the patient, they still have symptoms?
Yeah, I think it's not unusual for the initial test, and I think that's part of the awareness too. So it's oftentimes the initial test will be negative. Your body hasn't made the antibodies yet to fight the fungus, and so oftentimes as healthcare professionals, we if patients continue to have symptoms, we may repeat the test, a couple weeks down the line, and oftentimes you'll be surprised that valley fever was what was causing the problem.
Yeah, that's a real common one that, sometimes you'll need as many as 3 tests, because you just aren't, it's too soon.
Yep.
A little like the AIDS tests, it can be too soon.
Right.
To show, okay. Another question has come in. We've talked about our area, and they're wondering, why is it so concentrated in this area?
Creepy thing that lives in the soil likes it here.
Yeah.
I mean, that's
Wood
really
breeding
it.
ground
There's
for
no
fungus.
other reason. It doesn't like Sacramento. It doesn't like it. Yet it just likes it here.
Yeah.
Let's see. A question has come in. Are there valley fever spores? Can you find them in your yard?
They can be
They're everywhere.
anywhere.
Anywhere.
Anywhere women can carry them, they'll be there.
You could find them on your shoes, I suppose. It doesn't live very well outside of the soil very long either. It's really rather delicate. Thank goodness. It's not a hardy, horrible thing.
That's new. And we have some new viewers joining us, and they're asking again about the patient population or potential patient populations of individuals who are at greater risk. They said their doctors say that only people of darker skin tone can contract the virus more than people of lighter skin.
Anyone can get it. It's just that people of African ethnicity can get a more severe disease. But anyone who lives here and is exposed to it can get it.
Another question that's just come in from a new viewer. Is valley fever curable? Do we have a cure for valley fever?
Yeah, I think the answer was no cure. No cure yet.
Not at this moment.
Hopefully we'll have a way of preventing it. And
They still are working on a vaccine. They're working on a drug that's showing promise, but no cure at this time.
Okay. And we have a viewer that's just joined us that's asking us to introduce ourselves again, so they know who is here on this live Facebook feed. So I am Amy Olson. I'm a registered nurse and Director of Quality and Risk at Memorial Hospital here in Bakersfield. And we'll go down the line and let everyone introduce themselves.
My name is Dr. Ziba Yaman, and I'm a family physician.
Yep. Dr. Paul Miller, family physician as well.
And I'm not a doctor. I'm Paula Einstein, and my father was one of the valley fever, one of the guys that's been doing it, that did it a long time. he was really hoping. He was hoping that vaccine, that he would live to see that happening. And I remember him saying, when I came to the Valley, it was 95% death rate most of the time because it was so misdiagnosed. Because he did pulmonary chest disease. He said it now they're over 80, 85, 86%. I think he said are living with it, and he said I think I'll have to be happy with that. But it'd be nice. The nice thing about a vaccine is that then when Ethel comes to visit, she won't get it.
Right.
You can just have, which makes it even nicer than a cure in my feeling. But a cure would be really great too. That would be really nice.
And the information you just shared leads us to additional information. So you mentioned 1995, a large year for valley fever. So in 2016, we had 5,300 people in California were infected. And so that's the most since 1995. It's an increase by 2,300 cases, or 57% spike over 2015. And over 40% of those cases came from Kern County just last year. So it infected over 2,300 people and killing 6 in our community.
Yeah.
Let's see. What is the youngest that has ever been reported to have valley fever? And do children get it, and are their symptoms the same?
I don't know about youngest. I don't think babies. I don't think there's been cases. Somebody smarter than me may chime in with that. But kids definitely, and young kids, 8-year-olds, 9-year-olds. I mean, they get valley fever. But the youngest case, I don't know. What's the youngest you've seen? That's probably the youngest for me. 7, 8, 9, 10, that range.
Yeah, I haven't seen any babies with valley fever.
Yeah, I don't.
Personally,
They don't go out much.
That's me personally, though.
They stay in.
Yeah, that's probably part of it.
Okay, we've had a question that's come in. What's the difference between valley fever and mono? The symptoms are fairly similar.
One is a fungal infection, the other is a virus. So although the symptoms might be the same, the treatment is different.
Okay.
Yeah, there is no real treatment for mono. I mean, you get mono, it's a virus, and typically, again, you recover.
Right.
Although fatigue can be an issue, that's typically what people present with is prolonged fatigue. But yeah, two different animals.
Okay. A question has just come in. Do people die from valley fever, and does it go to the brain?
Yes, to both. It's rare, but it does happen. Yeah.
And we have a viewer who was recently or is diagnosed with valley fever and having lots of injuries with sprains like the knee, the wrist, and the neck. Is this illness the reason for so many? Is there a link?
Yeah, not that I can think of. I think it's probably bad luck. I hate to say it, but yeah, I can't imagine.
I have a question of, are there any certain areas of Kern County that are more at risk?
Kern County. Yeah, I mean, I guess, the areas that are undeveloped or where all the dirt is, I would think that would be the answer.
Okay. Are there any prevention tips outside of moving to another area outside of Kern County?
No, just stay indoors, roll up your windows when you're driving, and if you really have to go outside, wear one of those masks.
When it's windy.
When
Sure.
it's windy, yeah. When it's windy, yeah. Not all the time.
Yeah.
That would not be
Just
good.
don't ever go outside again.
And that leads us to our next question. Is valley fever worse during certain seasons?
The answer is yes. I think the late spring to early fall is the classic time, but people can get valley fever any time of the year, so that's important to know. But yes, there are windows, and I think in Arizona they have a couple different windows of time where, and it probably has to do with the rainy
People
season.
being outside
Yeah.
more. And,
All right, another question, again, just to reinforce about whether or not valley fever is contagious.
No.
No.
Thank goodness.
Let's see. Paula, you talked earlier about some of the research being done and then information about the dogs. Could you share some of that information again for some new viewers?
The other thing that I wanted to say is that especially if you've had it, which is another reason to be tested, because my father once tested himself, turns out he'd had it. He never knew it. of all people, you would think would have noticed. So you might have already had it. And therefore you have to be your own advocate, because because if something happens, you do get sick, there is something, you will be the one that has to insist on having a test and making sure that the right thing is done. So that's why I feel really strongly that everybody there should be a low-cost test, so that we can all know, because that's really important. Because I have to think about that as a survivor, and that's how they look at it. You're not immune. Your body's taking care of the problem, but it's still there. And that's, something you need to be aware of. I think everybody should be aware of, So that's why you need to know if you've had it or not. Until then, lots of research going on, lots of work being done. They're working on it's called nicomycin Z. They're working on that really hard. They're working on, Arizona is working on a vaccine. We just keep trying. Give money.
Money.
That's what it just takes huge amounts of cash, because all these things are so expensive. But that's why I want to give Kevin McCarthy credit, is to get this low-cost test done, there was it was like $850,000. And the town was trying to, this is quite a few years ago, but they were trying to raise the money and they couldn't get it done. And Kevin got them to waive that fee. And so that is happening. We're trying. We're, like I'm doing so much. They're trying. People are working on it. People are really dedicated. Go to a Valley Fever fundraiser. Help out. That's all you can do. The more you know about it, the safer you are. Because a lot of the masks and things like that, the holes are too big. It's a tiny spore. It goes right through it. It's really not going to protect you, completely. Knowing where to go, and you can't live your life not going somewhere because there might be valley fever there. For one thing, if it's 2 inches down, you can walk over the top of it. It's just something that this county or this area has to live with and has to deal with.
Okay, thank you.
But we can.
Yes. Another question: what are the signs and symptoms of valley fever, and when should someone go to the doctor?
I think we've talked several times about, just that cough, fever, sweats, body aches. And I think, prolonged symptoms. So if you're sick for a couple weeks and you're not getting any better, I think that's the time to maybe see the doctor. You don't have to run right away necessarily, because again, most of the time there will be the symptoms will be caused from other illnesses, colds and that kind of thing. But definitely prolonged symptoms, you should see your doctor.
You mentioned earlier about the antifungals used for treatment. We have a question about side effects to diflucan and what can be done about joint pain.
Like I told you before, we monitor the liver enzymes whenever we are giving antifungals like diflucan, and your anemia levels, all those things. So we monitor the labs and the blood. But otherwise, for joint pain, just pain medication if it's affecting the joint, and if it's swollen, we have to drain it, and then we treat it that way.
Yeah, one interesting thing about side effects from diflucan, which I didn't know about till recently, can cause a lot of drying of the skin, especially in the mouth, like we say, mucous membranes around the lips and that kind of thing. So that's another sort of common. I mean, it's not a dangerous side effect, but it's a nuisance. And in that case, if it's bad enough, you can actually switch to different antifungals that don't have as much of that symptom.
Okay. A question has come in: does the cocci serology test show if valley fever is active and how bad it is?
I think, it shows whether it's active, so it gives us, it helps us make the diagnosis of valley fever, and the test it's reported as a concentration. So although the numbers don't necessarily correlate with the disease severity, there probably is some slight correlation. So the higher the number, makes us maybe a little bit more suspicious of more aggressive disease. And definitely we use it as a way of monitoring the treatment of the disease. So we're looking for that we called coxy-serology. We're looking for that number to become undetectable with the treatment.
Okay, thank you. Questions come in. Can you see through an x-ray if you have valley fever in the lungs?
Imaging can be sometimes useful, but that's not really used for diagnosis. It's the serology which is important for diagnosis.
Okay. Paula, you spoke earlier about it living about 2 inches below the surface of the dirt. Someone's asking if they're cleaning out their attic or garage, are they at risk for contracting valley fever?
Only if they stick their head out the window and it's windy. Probably not. It's not going to be in dust in an attic and that kind of thing. It doesn't live very long outside of that environment, so even if a spore flew into your attic, if you don't breathe it in, it'll die. Woohoo! You know? So.
Okay. We've talked about valley fever affecting the lungs. Someone's asking, can valley fever affect your cardiovascular system, your heart?
There are other areas of dissemination, very rare. Liver, kidney, prostate, all those things have been reported. I'm not sure about heart. I mean, it would be, how about this? It would be very rare if it could happen. So that would not be a typical place that valley fever goes.
Okay. Let's see. Are there things that individuals can do for their house to make them at less risk for contracting valley fever?
Well, close the window.
Airtight, yeah.
Close the window.
Yeah.
Okay, let's see. How can individuals protect themselves? We've talked about the mask. Is there anything else that individuals can do to protect themselves when outside, not playing sports on dusty, windy days?
Yeah, I think that's the main thing, and I think Paula had a good point, and I agree with that. I run out in the foothills, and I mean, you can't be a slave to, I'm going to get valley fever. It's just common sense. It's a real windy day, and the dust is blowing all over the place. I'd probably, wouldn't do a whole lot of outside activities. But other than that.
Yeah. And the reason, because that dust is what's going to get underneath. I mean, it still is mainly trapped. There used to be a lot more valley fever in Los Angeles. There isn't now because it's all been paved over. Every time there's an earthquake, there's an outbreak of valley fever in L.A. It's the wind it's only going to do, it'll only work in the wind if it happens to get underneath enough soil. So it's a funny little bug. You can't be a slave to it. You really can't. You're right.
All right, thank you. Thank you to each of you. We're nearing the end of our discussion. I'd like to thank Dr. Yaman, Dr. Miller, and Paula Einstein for being here today. We hope that you have found this information educational about valley fever. If you or someone you know is showing signs of valley fever, please contact your physician or have your significant other, your family member, contact their physician. If you need to find a doctor, Dignity Health can help. Visit dignityhealth.org/Bakersfield. Thank you for your time and discussing valley fever.